From Studio 3C in Rockefeller Center, this is Today in New York.
We'll get that 7th day coming up. Hey, news for your health during a season when the common cold reemerges. The Ebola scare and the recent spike in enterovirus cases, they're causing greater concern, understandably. Dr. Ashwin Jathavedam is from Englewood Hospital and Medical Center. He's here to tell us how to protect ourselves from Ebola and all these things, and then bring some context to it as well. Hospitals are taking precautions. What are you seeing where you are?
Definitely where I work at Englewood Hospital Medical Center in New Jersey, the emergency department has prepared by obtaining protective gear. We have isolation rooms ready should we encounter any suspicious patients.
Now, you talk about the fellow down in Texas who goes to the hospital. He has symptoms. They sent him home. Now, there's some questions of what he disclosed or maybe should have disclosed, but how do you determine someone just has a stomach bug or someone that has something more serious?
It can be very difficult. I think the key is to get a very accurate travel history. I think that's incumbent on the healthcare providers to make sure they ask, especially within it's usually 21 days is the number we use. Any travel from Western Africa should prompt some alarm.
Okay, so we're talking about Ebola. Also, enterovirus is in the news. That is in our region. We have the sad story of the little boy who died over in Jersey. We keep using the phrases the mysterious illness. Try to explain that to us a little bit.
Enterovirus is a very common infection. Usually it can cause a cold, upper respiratory type symptoms. Not uncommon this time of year, from the late summer to the fall. This particular strain appears to cause much more severe illness in patients at risk with asthma or any other cardiopulmonary disease.
Now, is that who's most likely to contract it, or just?
No, those are the people likely to get very sick from it.
Okay.
We don't know the true incidence of this because a lot of cases may not come to fruition. The rapidity, especially the case in New Jersey, is obviously of some concern.
A lot of parents, I know this sort of season, we get cold season. Some of the precautions that parents and teachers should take are pretty basic, and we should be doing them this time of year anyway. Kind of take us through those.
Oh, correct, absolutely. So number one is hand washing. And by hand washing, it means being very thorough, at least 20 seconds. A good reminder to children is it's about the time it takes to sing Happy Birthday twice. Obviously, covering your mouth when you cough, easier said than done with the little children.
Right.
And lastly, is if someone is sick, is to stay home, especially with the fever. And finally, is disinfecting. If someone is sick, doorknobs, things like that, toys.
All things like that. Basic stuff. All this attention to Ebola and enterovirus, but there's something much more deadly we contend with every year, and that's the flu.
Absolutely. The flu season is just starting. We don't know, obviously, how severe it will be this year. The flu shot is out. There are no shortages, as far as I know. I would advise everyone to go out and get vaccinated. The more people we can vaccinate, the more we can limit the spread. And
they can usually kind of predict how the flu season is going to be. You know, some years are more severe than others. How are we looking down the pike?
It's still a little premature. We haven't seen really cases starting in earnest yet. I expect in the next several weeks we'll start to get an inkling.
Do you think, going back to Ebola and enterovirus, I think one of the issues that came up, especially with the confusion at Newark Airport yesterday, the hospitals are doing a good job. But in terms of government agencies, do you think more needs to be done dealing with possible pandemics?
Yeah, I think this is all very new. It's a work in progress. The exact procedures that they have to take still have to be defined. There's many agencies involved. I think they did the right thing yesterday in isolating all the patients, and vetting everything. I know it probably didn't go as smoothly as they would have liked, but I think at the end of the day, they did the right thing.
Better to be safe than sorry.
Absolutely.
Doctor, thanks for coming in. Appreciate your insight.
You're welcome. Thank you for having me.
All right, it's 7.